Excited to see you all. Hi, everybody. Good to see everyone again. Always a bunch of familiar faces, so this is great. Thank you for joining. We'll give people just another minute or so to finish signing in. Looks good. Okay, well, let's get going. Okay, so welcome to our Care Home Echoes. It's free, convenience of your own home. We can learn from each other. We can learn from the experts. We want you to get your continuing education credits and ask all the questions that you want. It's a great forum. We thank the sponsors here, which include Aloha Care and United Healthcare. Next slide. And for patient presentations, we just ask that you do not share patient names or birth dates. Your questions can be anonymous. And in fact, like last time, it worked really well. We are going to encourage you to private chat Shane Anderson when you're in the chat box, any questions, and then that Shane can read them out loud, and you're anonymous. So that will encourage asking questions and discussion if you like, or you could just discuss directly if you want. This is a safe learning environment. We don't want to have anybody feel embarrassed or feel shameful or anything like that. And that reminder that these are just case discussions. They're not official doctor consults, and they're for teaching purposes. Next slide. This is the chat tool. Don't forget to use the chat tool. In fact, if you could do that right now, enter your name and others joining the session in the same room with you today, just like you guys are doing. Look at that. You guys are pros at this. This is great. And of course, there's that mute button on the left, and make sure it's on mute when you're not speaking. Otherwise, we'll hear a lot of extra noises. And of course, unmute if you want to speak. Next slide. And today's topic is who knows what matters. We are doing a whole series, a 4-part series on what matters. We'll be talking about advanced care planning. Next slide. And this is a note that you can receive certificates of attendance after you register today, right? There's an evaluation that will be put in the link in the chat box later. And if you fill that out, you can get your CE credits. Next slide. And just a quick introduction. There's me, of course, the course director for the Geriatric Echoes Clinic. We have Lynette. Say hello.
Aloha. Thank you for joining us today.
Great. And Maribel, are you here?
Yes, Dr. Wen. Hello, everyone.
Great. Thanks for your support. And Juliana from Aloha Care.
Hi, everybody. Glad everyone's joined us today.
And Shane.
Hi, everyone. Welcome.
Yeah, Shane is our chat box monitor today. Thank you. Next slide. And of course, we have some guest speakers today. We have Dr. Rita Bell Fernandez. She is a geriatrician with the Department of Geriatric Medicine, associate professor. You can wave hello. And we have Jim Peach. He's a lawyer. He's a professor of law at the UH Richardson School of Law, and he will be also providing some expertise as well. Thank you all for joining. Okay, just going to do quickly some COVID updates. Next slide. Okay, so these are the infection rates. The blue line is Hawaii's numbers, and you can see we're coming down. Yay. So our case rate per 100,000 is coming down. We're on par with the US, the country, and New York City just has the curve. They were ahead of us a little bit. Next slide. But the real thing I really want to point out is that the death rates, look at that. Hawaii's death rates are really, really low. And I really attribute that to the good vaccination efforts that you guys have been doing. And everybody's so good with face masks and encouraging and all the aloha that you guys really have with each other. And love for kupuna. Next slide. So that being said, it's still not too late. We still have a number of people who have not vaccinated yet. So I'm going to encourage everyone, don't wait, vaccinate. And wearing a mask, it looks like everything's going down, but don't get lazy. Continue wearing a mask. It protects all variants, not just the cloth mask. avoid large gatherings, get vaccinated and get a booster. Doing so prevents infection, prevents severe illness and death. It slows the spread, and it reduces the likelihood of new variants emerging, and then we can have a better chance of stamping out this COVID thing. And, you know, even if it's really, really mild symptoms, like maybe just a sore throat or sniffly nose, get tested, because sometimes mild illness can still be positive, and you want to isolate in case. And according to the CDC, you know, if you are unvaccinated, you have a higher risk for testing positive, about 5 or 6 times. Higher risk for getting hospitalized, being so sick you have to go to the hospital, 9 to 17 times higher, and 14 to 20 times higher risk of dying if you're not vaccinated. So that really makes a huge difference. Next slide. And I'm just going to encourage you guys are on the front line. You know, you're going to meet people who refuse to be vaccinated. You're going to meet people who are a little bit afraid or hesitant. So I'm going to encourage you to don't give up the fight. Keep encouraging folks. Don't lecture or blame, just listen, identify concerns, understand that there is mistrust out there, and you agree that it is okay to have concerns. Clarify information, but don't get bogged down in the science and get stuck on that, because it's not going to change strong feelings. Strong feelings are emotional and has nothing to do with reasoning. But really just addressing concerns. Talk about personal stories. How was the vaccine for you? Why did you get the vaccine? Talk about aloha, kukua, kukuliana, and, you know, talk about how we are protecting yourself, protecting your loved ones, and doing your part to protect the community, doing your part to help end COVID. And if you can, you know, you can even offer help for scheduling or help for transportation, whatever it is their barrier is. Focus on the future, how it's going to get better once more people get vaccinated, and don't give up, because there are people even now who are hesitant, who are coming around. So it may take several conversations. So I'm just going to encourage everyone here to continue to try. Okay, next slide. And I just want to point out that this was shared from HAH for the nursing home community, that CMS released an update February 3rd, just a little earlier this month, on nursing home visitation FAQs. And so I will put that in the chat shortly. But yeah, that is another good reference to look at when thinking about how to try to do visitation safely. Next slide. Okay, and then I just want to take just a moment to talk about wellness. That in order to take care, because you guys in the job of caregiving, taking care of so many people, that you really must remember to take care of your own health and take care of your healthcare planning. Because when you do that, that also takes care of your family. Next slide. So I'm gonna so basically, you know, think about your own healthcare and what matters the most to you, and what's important in your life, and how do you handle bad news? How do you make medical decisions? And then share that with your doctor when you get a chance. This is a template from Stanford Medicine. I'll put that in the chat box when I have a chance in a bit also. And that's something that you can just look at for yourself and for your own family. And I also would like to encourage you to think about what we talk about today, not just for your residents, but also for yourself, because this is all part of taking care of ourselves and taking care of each other. Okay, I actually see a whole bunch of people with their hands raised from there, and maybe if Michaela, you could unless you guys have questions, maybe that was accidentally put up, but you have to put your hands down, that way I'll get confused. So Michaela, if you don't mind leaving instructions to how to put the hands down. Okay.
I'm not sure how they put their hands down actually. Maybe reactions.
Yeah.
So I can go hit the reactions button and then raise hand, and then I can go and to my reactions and lower hand. That's how you do it.
Oh, okay.
So if you find your reactions button and then go lower your hand.
Okay, great. Okay, great. And at this point, maybe we can just transition to Dr. Fernandez. So thank you, John.
Good afternoon, everyone. So happy to see over 150 people that are on this Zoom call. That's so exciting and a much better participation than our other ECHO series with the nursing homes. The care homes and the foster homes have come up with full force, and 150 people are here. So excited. You know, the care homes and foster homes, you are the backbone of Hawaii. Our state, I always say this at every talk, our state would never be able to manage the long-term care without your help. We simply do not have enough nursing home beds. We have a great shortage in the state, and you meet a huge need in our community by providing care home, foster home services. So we still have a few hands raised, and I'm going to ask each person if they have a question. Rosemary Olipani, do you have a question? I'm happy to give you the floor. Melencia Marquez, do you have a question? Your hand is raised. And Nora Lynn, if you have a question, you can ask it right now. Otherwise, we will move forward. Okay, this series is not what's the matter with you. Oh dear, what can the matter be? It is what matters for the person, what really matters most. It is getting to focus on really what's important, you know, because that can be lost. And sadly, it is often lost in the hospital. It is lost in the medical doctor's offices. So we want to focus this series, and it's a 4-part series. Today is only part 1, on what matters most to the person. So when we look at what matters, we want to know, can the person understand? Do you understand what I'm talking about? Do they have capacity? So we have this terminology in the medical healthcare field, and this terminology, they have a word called capacity. Capacity is a person is usually considered to have decisional making capacity when they can sufficiently understand, receive, and evaluate information to communicate a particular choice. So for example, I could ask the kapuna, auntie, do you want chocolate ice cream or vanilla ice cream? That means they got to know what is ice cream first, right? They got to understand, hey, that's ice cream. They got to know there's a difference between vanilla and a difference between chocolate. And then they got to be able to communicate a choice. And this is important because in healthcare, we have so many choices to make. Do you want chemotherapy? Do you want dialysis? Do you want radiation? Do they understand what this means? And this is what is decisional making capacity in the healthcare world. So capacity also differs to capacity for what? We cannot just say, oh, he has no capacity. Oh, she's old now. Is old now. What do you expect? No capacity. Actually, we narrow it down, because just because somebody is old, just because someone has dementia, doesn't mean they lack capacity for anything and everything, and they can't even tell us what ice cream they want. It has to be narrowed down. So let's look at capacity for what? Could it be activities of daily living? Maybe they can put on their own clothes, but they need help with toileting. Maybe they can do their own medication, but they can't do their checkbook. So they lack capacity for financial matters, but they are very well with other matters. Maybe they lack capacity for driving. They can do other things, but not driving. So it is very important when we are looking at capacity, we have to narrow it down to determine what exactly we are talking about. Capacity for what? And then it is who decides. Who gets to play God? Who gets to decide all this? Most day-to-day issues is determined by common sense, right? Isn't it common sense that you ask auntie, you want chocolate ice cream or vanilla ice cream? They can tell you what they want. So most everyday issues, you don't really need a doctor or a court or a lawyer. Most day-to-day issues, the family will decide, or you will be with the patient and you can say, no, uncle, you can't drive. Or maybe today is not a good day to go out driving. So we don't need a court or medical intervention. You may have heard these terms, capacity, and then there's another confusing word, competency. What's the difference between these two words? So when we talk about capacity, it is typically the medical doctors that are the experts in determining if a person has decision-making capacity or not. And you might go to doctors like geriatricians, neurologists, psychiatrists, the PCP, psychologists. They can all decide if a person has decision-making capacity. But if we say, oh, he's incompetent or she's incompetent, for competency, we need to go to the court. Because if a person is declared incompetent, then they lose all their rights, right? A person who is incompetent cannot even vote. You lose your right to vote as well. So competency is taken very seriously, and it requires a judge or a court to determine whether a person has such a legal capacity in such matters. And if somebody is declared incompetent, probably a guardianship or a conservatorship or some protective services are employed in these cases. And some of you probably have clients who have a guardian. Many of you are dealing with the OPGs, so you are familiar with this guardianship. Let's look at this. Who needs a guardian or a conservator? Does everybody need one? Does every patient with dementia need a guardian or a conservator? The answer is no. It's not that every single person needs one. It is for people who are unable to receive and evaluate information or make or communicate decisions to such an extent that the individual lacks the ability to meet essential requirements for physical health, safety, or self-care, even with appropriate and available technological assistance. So even with technology, even with the interpreter, even with help, they are unable to make decisions about their health, safety, or self-care. In order to get a guardian or conservator, it is a long process. It's not very fast. You have to petition with the family or the probate court. So it takes several months and it is a long process. But we have some alternatives. And let me just discuss again, what is guardianship? For people who have heard this word guardianship, it is concerning a person. It gives an individual the authority to decide on matters relating to the physical and mental well-being of a person. So the person would be considered the ward, their ward. And what all does the guardian decide? They can decide where they will live, caring for clothing, furniture, vehicle, transportation. They got to sign the consent form if a person needs a vaccine. Who is signing the consent? If a person has a guardianship, then the guardian is the one that signs the consent, providing care, comfort, and overall well-being for the individual. This is all the guardian's role. It is concerned with the physical and mental well-being of a person. Now, the conservatorship has to do more with the money. It is the property of the protected person. So it's like buying foods, managing their home, their property, acquiring and managing their assets, their stocks, their mutual funds, their bank accounts, their pensions, paying their bills. So this is the role of a conservator. So there is some downsides to it. One is you lose autonomy, right? A person gives up their autonomy to someone else. It also takes time and it takes legal fees because you have to go to court, you will need a lawyer to petition. So these are some of the downsides of going in the route of guardianship and conservatorship. But some people have no choice because if you haven't planned in advance, if you haven't planned, prepared, thought about these things, often there is no choice. And the only way out is guardianship or conservatorship. But that's why we're having this series. And I thank Dr. Wen and the committee for planning this beautiful series, because we want to talk to you about choices and options. And there are other choices that are better and easier to deal with than guardianship and conservatorship. So let's look at what are all these alternatives. We have healthcare power of attorney. We have a financial legal powers of attorney. If somebody can't pay their money and needs someone to do their bills, there is a representative payship that can be established. There are money management firms that can handle your money. There are trusts that can handle both the person and their property. So while you have your mind and your faculties and you can still decide, you can make these decisions and choose who you want in these very, very important roles. Now, I have the honor of having Professor Peach here from the law school, who is here to share his wisdom with all of us because he's seen horror stories and he has been in Hawaii long enough to see things have gone so sad for families. But there is so many alternatives that we have today. Professor Peach, would you like to share something? Because you have been such a leader in creating change in our state and having beautiful laws passed. So you were key to the Polls Law, the Advanced Directive Bills, and so many key legislatures in our state. So please share with us about these alternatives.
Well, I wasn't prepared to speak today. I was going to do more of the commentary. So I'll just comment on what you've presented so far.
Yes, please.
It's actually very rare that that in the legal profession you use the word competency, because the legal profession has moved and is moving even more towards the same usage as the medical profession in using the terms incapacity and capacity. So in our statutes, guardianship, conservatorship, you'll see the words capacity, a person's incapacitated to this extent. So we use the term mainly capacity and incapacity. Yes, sometimes they will in legal proceedings, competency is an issue. And you see that most often when you're talking about competency to stand trial because of mental incapacity of the individual, and also whether a person was deemed to be responsible for committing a crime after they committed. So that's a separate area and separate from the issues. The mental health issues are separate from guardianship and conservatorship, although very often an individual who has a mental condition that interferes with their ability to make decisions also lacks capacity. So yes, there are numerous alternatives to guardianship, and the most important ones are the Advanced Healthcare Directive. And on the slide here, you see the the healthcare power of attorney, and included in the Advanced Healthcare Directive would be healthcare power of attorney and individual instructions for healthcare. So that would help greatly with many of the folks in the audience today to have somebody who's able to make those decisions about healthcare and to follow the directions of the individual through the individual instructions contained in that Advanced Healthcare Directive. The financial and legal power of attorney. There's a rather new law in 2014, and it's somewhat of a complex statute. So, but individuals have a lot more power these days to make decisions, to make their decisions clear as to what powers they actually want to give to an individual. And there are more protections under the current law. So if one of your if one of the residents would like to have a financial or legal power of attorney, financial/legal power of attorney under the Uniform Power of Attorney Act, then yes, they should be seeking assistance from a qualified legal person.
Thank you, Professor Beach. Thank you for commenting on the slides so far. Appreciate it. I do see we have some questions and hands raised, and we'll save it to the end of this legal presentation. I will continue with a couple more slides, and then we will take questions. So let's look at each of these alternatives one by one. Power of attorney. Power of attorney can be your friend, your family member, whoever you want to name, but you got to choose that person wisely. And there are different types of powers of attorney. You can get full legal and financial powers, or you can have limited powers. It can take effect immediately or effect on incapacity. And usually you can revoke it. Either you can have it a written revocation, or you could make a new power of attorney. So these are the three important things to remember about power of attorney. When we say limited power, let me give you an example. Say I'm buying a real estate and I'm going out of town. I can give limited power of attorney just for that real estate transaction to someone else, maybe my friend, to do all my escrow signing. So that's an example of a limited power of attorney. But you can also give somebody full legal and financial powers. This is what the form kind of looks like. You have general or specific, you have durable or non-durable. You can say it's effective immediately, or you could put some dates. You could put an effective date, a termination date. You can even add any special instructions. Professor Peach was referring to the 2014 law, the Hawaii Uniform Powers of Attorney Act. And here, under this statute, there is a lot of powers given to the power of attorney, as well as there is consequences for misbehavior. So if someone tries to take advantage of you or tries, there is liability. They can be prosecuted by the law if people try to commit fraud in this manner. So please choose your power of attorney wisely. And this is different. The general power of attorney is different from the healthcare power of attorney. In the healthcare power of attorney, they're only concerned with the doctors and the hospitals and making medical decisions. And this is kind of what the form looks like, the Hawaii form, State of Hawaii statutory form of power of attorney, where you designate an agent, and you can also have an alternative agent or optional agent as a backup. And then, whether you're giving them full powers or limited powers and other stipulations, when it's effective, when you want to terminate it, that can all be put in the form. Now let's move on to other alternatives to guardianship and conservatorship. If a person cannot manage their money, maybe they only need money management services. Maybe that's all the help they need. And there are many things that can be done. One of the simplest one is automatic bill payment, right? You don't want somebody's electricity to be cut off, the water to be cut off. So let's put all this on auto payment. HECO is on auto payment, the Board of Water on auto payment. In this way, the seniors' bills are being paid. Even Social Security check, there is so much fraud in sending the check in the mail. Social Security Administration encourages direct deposit. So anything that we can do in this automatic electronic manner reduces fraud and scams on seniors and helps with better money management. You can assign a rep payee. I have done a lot of these forms for my patients when Social Security is concerned about, the patient's money in $800, $900 is just gone in the first week. They're buying cigarettes for somebody, they're paying someone else, their friend, their neighbor. They're too kind, too generous. And when you're too kind and too generous, the whole money is gone in like 1 week. So Social Security then makes the doctor fill out a paper to say, can this person manage their money? And if they cannot, then a rep pay gets assigned. So these benefits, such as their Social Security benefits, someone else will manage their money and give it to them like a budget. It's like a budgeting. So it's their money, but they don't spend it in a foolish manner, or it's all gone in 1 week and then they have no money for rent and no money for food. Even the VA has some programs called the VA Fiduciary Program. Again, once a medical documentation is there, they are then able to assign a fiduciary or a representative payee to help that person budget and spend the money wisely. Another alternative to guardianship and conservatorship is to make a trust. I know you've heard of wills and trusts. Trusts are interesting because it even concerns the person. The person can be the trustee, and when they cannot manage themselves, yes, you have an executor, and the executor can then take over as the successor trustee and manage the trust. So you have a grantor, a trustee, a trust, and beneficiaries. I always thought that, you make a trust so that your assets then go to the beneficiaries. But actually, it's not so much for the beneficiary, but a trust protects the person themselves while they're alive, and the successor trustee can take over and help the person manage their affairs without having to go through guardianship, without having to go to conservatorship. It is a much smoother, faster, and easier process. So what are the different trusts we have heard of? There is testamentary trusts, there are living trusts, there are special needs trusts for persons with special needs or disabilities. In the living trust is the most common one. You have heard a lot of people may have made a living will or a living trust. And typically this one can be revocable or irrevocable. The commonest one that people make is the revocable living trust. Revocable means they can change it anytime. They can change who is the beneficiary. They can change who is the successor trustee, who is the executor. They can make whatever changes they want. An important thing to remember is when you make a trust, everything doesn't magically go into the trust. You've got homework to do. You have to then put your property in the trust. You got to do the next step. People forget there is another step to this. They make a trust, but things don't come automatically in the trust. You got to then put the bank account in the trust. You got to then put the property into the trust. That's how things get inside the trust by another step of paperwork. And then these assets are protected by your living trust. A wonderful resource that explains all this beautifully It's Professor Peach's book and Dr. Lenora Lee's book. They have co-authored a wonderful booklet called Legal Handbook for Hawaii's Older Persons, Families, and Caregivers, deciding what to do and why not now. There are many copies of this available. You can get them from our Department of Geriatrics. We have also given these to the associations, and you can get a copy online as well at the UHelp website. So please look at this as the textbook and the handout for this 4-part series. I would like you all to have this handbook as we do this in the next few months, because it will give you a very good understanding of each of this guardianship, conservatorship, power of attorney. Everything that we're talking about is explained beautifully in this booklet. So what is your next step? Please look at your patient's chart. I know every care home, nursing home, foster home, you got a chart, a nice big binder. Look in the binder and see, do you have these things? Because maybe the patient has this, but you don't have a copy. You need to get a copy. If they have a guardianship, make sure you have the copy of that. If they have a POLS form, make sure you have a copy. If they have advance directive, make sure you get the copy and it's in your care home, in your foster home chart. So look for these 3 things. Look for advanced healthcare directive. Look if they have a power of attorney, and look if they have a post orders. If you have these 3 things, you are very well covered for any kind of emergency. Yes, we do not want a fire, but we want to be prepared with the fire extinguisher, right? we want to be prepared. So having these things, please look for these 3 things. It's a good time to get your charts in order. And we request you to share with our team. So Michaela, would you like to discuss this, please, on how they can share with Web about this document?
Go cry in there. Go hit the wall. Hit the wall.
Sorry,
There.
John, can
Hit
you
the wall.
mute?
Hit the wall. Go hit the wall. Hit the wall. Hit the wall.
Thank you. So after this session, we're going to be doing our regular evaluations, and we need an evaluation for each person that attended. So if you had more than one caregiver attend, please have each one of them complete it. Afterwards, you will be getting an email to your email address with a new link on how you fill out this document. And basically what we want to know is how many of your residents, say you have 5 residents living with you, how many of those 5 have a healthcare power of attorney? So if you have 3 of them who do, you're going to write 3 on how many, and then you're going to write down 5 for your total amount of residents. It's just like the depression series that we ran from October to January, which we do have data to share with you guys. I also have a link for everybody to complete their PHQ-2s if you did not get a chance to do that last week or last month, because we do want to get as many responses on that as possible so that we can show you how your residents have improved. And we have seen improvements, which is great to see. So you'll be getting an email with both of those links, one to do this tracking on whether or not your residents have had power of attorney, care plans, or pulse, and a second link with the PHQ-2. And I know this is a lot for you guys to fill out. We really want to thank you for doing this. We're grant funded. I know I've told you this before, we're grant funded, and that's how we're able to give you guys this education free of cost, and provide you with certificates of attendance free of cost. And this kind of reporting really helps us maintain that grant funding. So I will give the link for the evaluation after we're done taking questions, and I'll hang out afterwards in case people have questions. I can walk you through how to do this. Yep.
Okay, question time. All right, so I don't know, Shane, there's some questions in the chat box, and there's some, I don't know if they private chatted you, if you could go ahead and go through them.
No problem. Yeah, the only question really that I see so far is, can my resident choose me as the primary caregiver as their healthcare power of attorney?
Professor Peach, you are the guru on all these tricky questions. So we're so honored to have you here today. Do you mind answering that question, please?
Well, it's not settled, but there's always the issue of conflict of interest. So you're making healthcare decisions for somebody that you're caring for. The long-term care ombudsman, the Department of Health, the Attorney General, Adult Protective Services, all those folks have had discussions about this. But generally speaking, a person who provides care for another person should not be the one who obtains the permission to provide care for that person. So it's like a doctor. For doctors and nurses and other healthcare providers, it's very clear. It's a conflict of interest. You should not accept a power of attorney from your patient when you're treating the patient. So for issues relating to other caregivers, it's a very difficult question of potential conflicts of interest. Similarly with powers of attorney, trusts, all those types of documents, it's a great potential for conflicts of interest involved. Now, for representative payees and those type of flow through types of issues, that will be dependent upon the Social Security Administration, and for fiduciaries, that would be the Veterans Administration. I saw a question popping up, what if they don't have family? Well, then there is a separate subject. It involves the Office of the Public Guardian. Public Guardian makes healthcare decisions for individuals who don't have families or whose families are not willing or able to make decisions for them or don't want to be involved. But that's a complex question. And there's no yes or no answer to it.
Thank you, Professor Peach. Thank you for shedding light on this.
Oh, and then it also depends on your licensing. Certain healthcare providers are covered differently for this. So you should check with the Department of Health as to whether you are considered a healthcare provider. So in a nursing facility, for example, a nursing home, generally speaking, they would not be permitted to be the person making healthcare decisions for them in that facility. So you may wish to get the long-term care ombudsman or the Department of Health to do a separate session on what are your duties and responsibilities and how far can you go in representing somebody that you care for. Of course, prevention is the best thing. So I know that many individuals in your facilities possibly do not have sufficient capacity to execute such documents. But if they do, then it may be time for them to, there's nothing wrong with you calling, if they want you to get with their attorney, with an attorney, with the Legal Aid Society. The Legal Aid Society provides free legal services. And times of COVID are different, but they, in non-times of COVID, and maybe we'll get to there, they also make house calls.
Thank you, Professor Peach. I see a couple more questions. One regarding resident on Medicaid only, no guardianship, asking if the person passes away, who do we call? Families refuse to take guardianship.
Yeah, it's sad, isn't it? Where you have families that don't want to take part, except maybe to get the estate later on. Yeah, there are protocols that the doctors have on who to call upon a death. And it's not going to be 911, of course. In the old days, people would call the ambulance, but if they are in hospice, the hospice protocols would be involved. If not, then I'd probably ask one of our doctors, what's usually the case when you have somebody dying at home?
Usually when someone dies at home, you would notify their PCP. The primary care or the attending physician is notified because you need someone to sign the death certificate. That's a very important document because without a death certificate, nothing is going to move. Nothing is going to get cleared, whether it's life insurance or whatever. But I really want you to think of as a care home operator and a foster home operator, if somebody is looking towards the end of their life, please, please, please consider hospice. There are 5 hospice companies on this island, and they provide a valuable service because they can help with all of these things, from bereavement support, mortuary, contacting the family, what happens to the remains, what happens to the staff. The social workers, chaplains, they are professional at this. So if you have a patient who you think is going downhill, even if you don't know what diagnosis, but you think, oh my gosh, I won't be surprised if this person passes away, please contact one of the 5 hospice companies, because that is the best gold standard on providing the best care towards somebody at their end of life. It will take all this stress off your back.
I agree completely, and they're wonderful people at hospice. And as I mentioned, they have protocols, what happens when a person dies. So if a person does die, like this unfortunate comedian died in his hotel and nobody ever expected him to, but if one of your residents dies like that, don't move the person, just call the PCP. If you are really concerned that it may be suspicious, then of course call 911. They also have protocols to determine whether or not it's an emergency or who to contact, whether it would be the coroner. It much depends also if they have that care plan in place that Michaela was talking about for your quiz. There should be in that planning document, if they have already funeral memorial plans, something already set up. So that's very helpful for you and of course, for the deceased. So that's why so much emphasis is being placed on advanced planning, including advanced healthcare directive, advanced planning documents, and the PULSE form. You should know when you're filling out the survey with respect to advanced directives, as an example in PULSE, it's not a test that you're going to get a grade on, because both federal and state law are very clear that nobody can force anybody to fill out one of these forms. So it's a personal choice. So the question they're asking is for their information. How many have? Maybe we need a better educational plan. But we've all seen this with vaccinations in the first 1 or 2 slides of this presentation, where people just don't want to do things. A lot of people just don't want to be forced to do anything. So it's that quiz, and Michaela and Dr. Wen can correct me if I'm wrong, and I very often am wrong on things, but it's not a grade that you're going to be getting. So it's like the second slide, no shame, no blame. This is just information that's passing both ways here. So I think they're just very much interested in what does it look like out there as far as people planning advance. Maybe we all, as we are younger, need to do a better job in planning for the future and not waiting till they're in your care facility, because they may not have either the capacity or the inclination or the desire or the strength to do a lot of these things. So But again, it's not, you can't require anybody to have an advance directive or any other one of these documents.
That's right. And actually, I just want to say, it's just encouragement. And our hope is that over this series, 4-part series, you'll have the tools and be able to have some of the understanding and be able to have discussions with your residents and their families to encourage them to be able to do it better. Okay, so Michaela, want to share?
Thank you, John. Yes. So for those who have been coming to our series since October, you know that we have asked you to fill out a PHQ-2 to see where your residents were. And like Dr. Peach said, this isn't a quiz, this isn't a grade, this is for you to measure where you're at. So in October, we are seeing about 42% of the residents were showing no signs of depression. 31.6 were showing some signs, 19.5 were showing moderate depression, and 6.6 were very depressed. And now in January, those who have done a post survey, John, if you'll back it up one, we're seeing 41% are saying no, some is 38%, moderate is 18%, and 3% are very depressed. So we are seeing some improvement in here. I would love for you guys to continue to send us that another month so we can see, especially if you haven't completed another PHQ-2, please do submit it and we can look at it again next month. And this is just a way for you to see how your residents have changed and to take stock of what's happening. Yes, this isn't something that you're graded on. This isn't something that impacts your ability to come and continue to get education with us. This is something that is intended to help you and intended to help us. So thank you everybody who has been doing it. We really, really appreciate it. And I will stick around afterwards to do these evaluations with you as well. Go ahead, John, and forward it. 2 slides, I believe. Yes, this is, thank you for sharing with our team. And those are tied to your certificates of attendance. And if you need any help, I'll be around for a little bit after this. We do have another meeting, so I can't stick around for too long, but I will be around after this. And if you need help, you can always join me tomorrow at 10 a.m. or at 2 p.m. or at Monday at 2 p.m. or email me. There's my email right there. And I can put it in the chat box too, if anybody wants it. And I will now release our evaluations unless anybody else has anything they want to say before I send the evaluation.
I did see some question pop up on the chat and disappeared, but it was whether or not 5 wishes can be used as an advance directive. And yes, of course, make sure that it's a 5 wishes document that that has been approved for use in Hawaii, because all states have different laws. And there is a form that has been approved for use in Hawaii. And the best place, and I think it's on your resources, is, and will be in your next series, most likely, is at kokuamau.org.
Yes, tune in next month. We're going to talk about how we get at these discussions.
And
There
one
is another-
more question. Oh, go ahead.
Go ahead, Sharon.
Yeah, one other question that just came in was more specific to the patient is rich and family is beneficiary when it comes to medical POA. What do you think?
The family is rich, and what does that, and what about the medical POA?
It sounds like the patient is rich, and the family is the beneficiary.
Oh, yeah,
when it comes to the medical POA, what do you think?
Yeah, I think I know what you're talking about. And there's always this potential conflict of interest and undue influence, because we've seen in the literature, we've seen people who will use a power of attorney as a, shouldn't even say it, I won't, but not appropriately, and then the individual dies and then they inherit instead, because they'll say, well, I had 10 years worth of assets that I could have lived very nicely in this wonderful care home. But no, saw one case not too long ago where it was about the issue of dialysis. And they said, nope, I'm not going to go to dialysis anymore. And so there was an intervention in that case. So you're very right. If you suspect a potential for abuse, you should be consulting with the Adult Protective Services. If you think that that's what's happening in financial exploitation, improper healthcare decisions, not in the best interest of the individual. Yeah, that's a very good question. That's a whole 2 hours discussion on conflicts and improper use of these documents. There are sanctions, of course, for improperly doing things, but it's very hard. 2 of my students have served as prosecutors for elder abuse in Hawaii. And one founded the section, and the other is now in that section. And they call me regularly, or occasionally at least, but sufficiently a number of times over the year to just touch base on these type of very, very hard issues. Is it a crime? What happened there? What was the cause of death? So all these mysteries, we could have a whole Netflix series just based on the stories with you folks. So yeah, but keep vigilant. And if you have a real concern, the Adult Protective Services line is, they're very, very nice people to chat with. So they're not just enforcement, they're there to stop and to intervene on potential abuse. So that's a very good question.
Great. Well, we're at the end of our hour, and I hope you learned a lot. So please come back next month, and we'll continue with our series, and we'll go more in depth about how do we get at these really important discussions and what's a good way to do it. And of course, you guys can share your experience as well, and share it with each other as well. So thanks so much. And we don't forget to complete your certificate of attendance. The link is in the chat box.